So I think you can communicate the others. They are waiting.
Yeah. No, I just called him. He's in front of the computer.
Yes, sir. Sir, you can communicate with other participants. They are waiting.
Okay.
Because all suggestions from you are very valuable, sir. So we are waiting for that. We can utilize that, sir. So let him.
Okay. Our guest is trying to get connected. By the time today, we have a very important topic, infertility. He has around 3,000 resolved and documented infertility cases with him. He's a leading practitioner in Karnataka, Bangalore, and has been very active in the development of homeopathy also, and a great practitioner mainly. That's the main thing about him. And his experiences will enrich us in our practice also, I hope. So I'm trying to get connected. There is something. Yes, he has joined. Please unmute Dr.B.T Rudhresh. B.T Rudhresh.
Sorry, sir, I can't find him.
No, I saw him in the participants list.
Yes,
Yeah, he has been included as co-host.
so that he definitely he can unmute from his side, sir. Please,
Hello, Dr. Rudhresh. Please unmute from your end.
Sir, please raise your hand, sir. Today, sir. Sir, it is not visible, sir. Not in the participant list.
No, I saw him. Yeah, it is there in the participant list, Dr. B.T Rudhresh, 4th or 5th.
Okay, sir. Fine, sir.
Okay.
Yes.
Hello, Dr. Rudhresh.
Yes, sir. Good evening, sir.
Good evening. Okay.
Am I visible?
Yeah,
Am
now
I visible?
no, we can hear you, but not visible.
Not visible. Okay.
visible.
1 second.
Yeah.
There is heavy rain here.
Uh-huh.
The nets are very slow. Yes.
So today is a
Yeah.
60th uninterrupted webinar, and
Yeah.
International Promotion of Homeopathy, Ifph, is conducting this webinar for the last 360 days uninterrupted. We have participants from all over India and from around 32 countries around the globe. So today, Dr. B.T Rudhresh, MD Home, is the president of the Karnataka Board of Medicine. He is the member of the Executive Board of Governors of Central Council of Homeopathy. He is a faculty member of Rajiv Gandhi University of Health Science. Sir, there is some disturbance from your end. Please check. Okay. Then he's the chairman of the and the Board of Trustees of Rajiv Gandhi University of Health Sciences. And he's a member of the Senate and Syndicate of the Rajiv Gandhi University of Health Sciences. He's also a council member of the Council for Research in Homeopathy, Government of India. He was a member of the Council of Homeopathy also. And he's the leading practitioner in Bangalore. And we have around 3,000 sold and documented fertility cases, which we will be sharing with our participants. The topic is infertility and homeopathic perspective. So, good morning, good afternoon, and good evening to all. And I welcome you, sir, to our forum for
Thank you. Shall we start?
Yeah, can.
Good evening, everybody. Thank you, Jose Isaac, Shaji Kodiyar, and all the members of IFPH. for giving me this opportunity to share my clinical experiences with all of you. I am practicing from past 40 years in Bangalore city. Every day, at least more than 100 to 120, 150 patients visits me by taking appointment 2 months in advance. I am not a infertility specialist, and I am sure none of us will start. Am I audible, those Isaac?
Yeah, audible, no problem.
Yeah.
But there is some disturbance.
Yeah, I told you here there is a heavy rain.
Maybe.
And I'm sure that because of the net is also slow here.
Yeah. But you are clearly audible, no problem. You continue.
Okay. So, when we started our practice, I never started that as a infertility specialist. Neither any one of us, if he is a practitioner, if he has opened his clinic, a doctor can't choose his patient. Patient can choose his doctor. That's what the whole thing all is about. My first experience was with a gynecologist of a very leading hospital in Bangalore. She had an anencephaly fetus which has to be terminated at 8th month. Somebody said in her hospital that there is one possibility of this to escape by going through homeopathic treatment. They give you something called as a constitutional treatment, then your pregnancy will be all right. So what I did was, she came to me with the same thing. Look, I had a pregnancy and anencephaly, and we had to preterm delivery karke nikal diya. Now can you do something before I conceive? Then of course I just did not have any kind of idea of treating this kind of thing. But I had to. Hello.
Sir, please continue, sir. Please continue.
Hello. I'm audible.
Yes, sir. Yes.
So what I did was, I just went through all the miasms, psychosis, syphilitic, psoric, and all those things. Then somehow I attributed that for her as the syphilitic miasm. I started with a dose of syphilinum first, then went to sepia, then went to beretacarb, treated her for 6 months. Then I asked that gynecologist to conceive. She conceived. The pregnancy was uneventful, and almost she delivered a normal child, a male child. That is my first case around 15 years back, 15 to 18 years back. She started sending all her repeated abortions cases to me. And with the same intention, I did not belong to any group, and I was just following whatever as the Arnhemian way of thinking. Take the history, make whether it is repertorial or non-repertorial, or take an entry to the case and start treating them. Now, over almost around, I think now around 10, 12 years now, my practice in toto infertility cases in a day. Hello. Hello. Hello.
Yes, sir.
Yes.
Audible.
Hello.
Okay,
So my infertility cases in a day will be almost just to 15 to 20%. Other 80% of my practice is almost from simple cold to cancer, you name it on this earth. So initially when we started, as I told you, I was not an infertility case. But today, to my credit, I have 3,000 documented cases. I will show you at the end. I have around 1,000 mother and child photos. My clinic is a typical old type one. I don't have videos. I don't have only the moment they come, a big reception. It is typical old timer of homeopathic practice. So when they come with the child to show it to me, I've taken photos and I will show you at the end. I have around 1,000 right now with me. Now, what is these infertility cases? Next. And I have seen when I started improving along with the patients' inputs and lot of this Bangalore and all over Karnataka, they started sending cases as it was reported. In 2002, around 2004, I had around 200 cases. I had called around 20 patients with their children to a press conference. That's when it became almost everybody was known for it. Then finally, when the whole press started talking about, they started interviewing, TV interviews started, then there was a full-fledged infertility clinics. And we all know that. Now straight away, I will straight away come to that because we have already taken some time because of my technical snag. And by treating their infertility with homeopathic medicine, and 30% of these parents are doctors today. I must tell you that. Can I do? Okay. Illustrate ಮಾಡಬೇಕು. Okay. Okay, now why anybody? And I told you almost I have around 30% of my patients, especially with infertility, they are almost our allopathic brothers, Ayurvedic doctors, yoga doctors. 30% of my inflow are doctors. Now, straight away I'll come to the next thing. What is a child? Of course, we all know the child is the greatest gift of God. And why do we like our own child? Why don't we? And what is a child? And I'm sure child is an extension of your own self. That's why we like our own children. Yes, if you want to be a little bit of more of Gandhi, Vivekananda, and very great people, then they started considering everybody as their children. But in a common parlance, for a common man to have their progeny, of course, we all know Shakespeare said very clearly, man lives through his poetry and progeny. I'm sure everyone can't write poetries, but they can certainly indulge with progeny. And in Indian ethos, I'm sure if people are watching from Europe, if people are watching from UK or any other Western countries, including US, now the new trend is, okay, you are there, I am there, why do we have a child? And that what so-called the modern thinking of not having child, we live for our own self. No, that is not there with Indian ethos. In Indian ethos, if a married couple, if they did not get their child within 2 years, I'm sure she will be literally, the unwritten law is to outcast from the society. If she doesn't get after 2 years, she will prohibit herself going to all the what do we call, all the functions, ceremonies, or whatever has been done. She withdraw herself and become depressed, and our society will treat in a different way. A mother, a woman is certainly without child. She will be certainly outcasted in Indian ethos. And of course, the Indian society has believed the perfection of womanhood is in motherhood. Without motherhood, the womanhood is not completed. That's what we believe in. Now straight away, if I go to that, whoever has come to me, 90% of them, or even 95% of them, they all have gone to all the doctors, all the Santana Lakshmis of the cities, and they have even come from UK, England, all the Arab countries, Ghana, West Indies, you name it. And the typical way of explanation is that we have gone to all the doctors, we have literally done everything. I will show you how homeopathy can travel from typically from the simple, what so-called the unexplained infertility, to the most difficult cases of tubal blocks. How homeopathy has solved, we'll go to that. And people have lost their houses, they have sold their houses to become pregnant. What an amount of procedures which those doctors goes. In fact, a lot of females have confided with me that they are more comfortable coming to a homeopathic doctor. In fact, one lady made a categorical remark. Sir, मैंने कितनी बार गया, वो doctors every time they insert what not to me. They did lot of procedures which I can't bear. You have not even touched my pulse and you have treated for 1 year, 6 months, 3 months. Now I am conceived. That doesn't mean that you will not, you don't accept all that. But unnecessary procedures for everything IUI, for everything IVF, for everybody tube test, for everybody hysteroscopy. How many can afford a thing which can happen so normally? That's why we are 130 crores. Now, why I am trying to tell you this, they have done all the procedures. I must tell you, I had one lady from the family of doctors in Bangalore, a big nursing home. There are 8 doctors in the family. This lady was 37-year-old. She had 13 cuts on her abdomen. 13 cuts. What not they had done? Appendix burst hua, ovarian cyst, PID, peritonitis, what not you tell me, and they have done that spensogram and what not, 13 cuts, and she wanted to conceive. I said, Arey ma, why, of all the people, of all the zoos in animal, why me? She said, no, you try. and there was a lot of scar tissues, striations in her uterus, and for any, forget about any homeopath, even for an allopath, I'm telling you that they said it is a foregone conclusion that it is the most worst case I have ever seen. Can I take, or a homeopath can take with tubal blocks, with so much of fibrous tissue into striations in the uterus, there is so much of fibrous bands. And anyway, I said, okay, if you force me, I will take. Believe me, I treated that case for almost 9 to 10 months, started treating with her thiocyanamide, and all the bands were released. I started treating her with Calicarb, later Ufrinum. After 1.5 years, she conceived. The 14th operation was a cesarean. She also got a male baby. That has brought a very big name amongst allopaths, that whether such things can be done in homeopathy. This is what homeopathy can do. Of course, I don't need to define what homeopathy is, what is the highest ideal of cure, and how you can alleviate the suffering soul. And we all know what is infertility, inability to conceive due to causes either in male or female partner. Unfortunately, in Indian ethos again, a female is always being targeted, telling that you are the cause. I have seen 3 years, 5 years of treatment given by a gynecologist, not even once getting done the male partner's semen analysis. In many cases, I have seen the first thing I do on my first consultation, if the male partner has not been semen analysis, if it is not done, the first thing is I get it done. In many cases, either it comes azoospermia or it comes oligoasthenospermia. The count is too low, motility is almost gone, but poor thing, they kept on targeting the women. Etiology is, we all know, in a male, systemic factors like diabetes, obesity. I must tell you the first 3 causes of etiology in any one of the T. Number 1 is obesity. Number 2, tuberculosis. Number 3, psychological imbalances in the spouses amongst themselves. In male, endocrine factors, defective spermatogenesis, of course, psychological, lot of ED cases, erectional and premature ejaculations were mainly due to psychologicals, and of course, if it is physiological and pathological, like defective spermatogenesis, pathological like duct obstructions were also done. In female, systemic diseases, suppressed ovulation were obesity, PCOD, genetic and anatomical defects. I'll show you. I don't know if I don't have time. Probably I have lost 15 minutes. So I don't know whether I can be able to show their anatomical defects. Where I had one infantile uterus. A girl has never had her first menarche, almost an infantile uterus. The father, who was a lawyer from Mandya, kept on pestering me to treat her, much against my wish. I treated her for 2 years. Her infantile uterus almost became normal. She started menstruating. The medicine given there was aurum euro, natronatrum, and beretacar, 1 or 2 doses of tuberculinum. And the beauty part was, after she started menstruating, she got married and she came back to me after 2 years for a child, and luckily she got it. And that's what even anatomical defects has been done by homeopathic. Of course, causes in female, you know, if it is a cervix, pinhole cervix, fibroids, endometriosis, tubal block, and of course, problem with the management of male infertility. This, I'll straight away go to the cases. I'm sure I'm short of, this was my first case. A man of 37 years, married for 10 years, wife aged 30 years, came with complaints of primary infertility, reports suggestive of azoospermia. I don't know how many of us dare enough, including me, if it were to come on the consultation with a ready-made pathological report telling that it is suggestive of azoospermia. On a first consultation itself, I don't know whether I would have been accepted. See the pathology. See the pathology. Left testicular distortion, right epididymal calcification, bilateral chronic epidydymioarthritis, bilateral varicocele grade 2, and 2 years back operation was done, but after varicocele it was again relapsed. Then when there is highway, they say why go in byway? After seeing the pathological, I'm sure whoever is watching this pathology with a azoospermia, with this kind of pathology, can you assure the patient that you will have some positive results in this case? First thing I told, it is not possible. On pestering by the patient, I just took up the case and I just went through and see the beauty. Then I thought, if I take the pathological approach in this case, I'm sure I will miserably fail. So I took the second chance or second choice of understanding the person, going through life space investigation. It was unfolded. It was a very interesting study and observation. The patient was very reserved, running a tea stall near Tumkur, that is around 60 kilometers from Bangalore. Has been brought up in a lower middle class setup. Patient has always been a very sensitive child, unable to study because of financial stress. That's why he was running a tea stall. Anyway, nowadays, after seeing certain political developments, running tea stall can lead you to many things, and the same thing has happened in this man. He has always felt that respect and honor are very important to him. Where most of our VIPs, most of our, I don't know whether we have role models in society, how well you can do it, only giving, of course you all know, homeopathy, naming a disease, giving one medicine to one disease, he is not a doctor. He is a peddler of medicine. What have been taught to us? We have been taught to us, man has to maintain harmony with work spot, society, and family. If there is a disharmony in these three, anywhere, that's where the disease starts. And this is what has happened. And though he was a poor man running a tea shop, he felt respect and honor are very important. Where nowadays, even if they go to child, they come on a hathi, on an elephant, here, anywhere in India now. So he has used massive suppression as his business often involves meeting so many types of people. They used to come to tea shop, take a cup of tea, take a cigarette, and talk to him for 10 minutes, 15 minutes. How are you, man? Fine. Married? Yes. Having children? No. Why? How many years of married? So many years. Why didn't you get? So this went on and on and on. At last, he almost become, it became so suicidal to him that he has to keep on answering people as if he is important. And you know, in our society, people, how they talk. And then I went through, I found out that he was brought up with a rigid, strict environment. And I'm sure a poor man can't have his sex and anger, let it out. And if he were to be a very big man, he could have both, get it done. But this poor man, he has suppressed both his sex and anger. Because of his condition, he is experiencing further humiliation and mortification. I'm not going through, I have just made these rubrics after going through in my second consultation. I took almost 1 hour for this case to bring up to this level of rubrics. Nobody comes with rubrics to you. You will have to form your rubrics after going through patient's language, bring it to the medical language. Yes, now I will not go on asking questions to you, and this is what I did. Because of, I took ailments from suppressed anger, ailments with mortification, humiliation, embarrassment, wounded honor, offended easily, sensitive to reprimand, trembling from anger. Staphysagria 1M. What is staphysagria? Sweet and gentle suppression of emotions and anger, suppressed sexuality leading to masturbation and a romantic, erotic inner life, styes, tumors in eyelids. This plant is an elegant, tall plant, ornamental in nature, belongs to family of Ranunculus. The plant stands erect along the fence, modest, haughty, far too sensitive to show the emotions. Stems are sturdy, hollow, breaks with the winds. Patient is, you just compare this, the plant to the man's emotions and stresses, how he is easily vulnerable. This is how you study materia medica, you study a medicine going through its origin, its nature, the way it has been brought, and so on. Action of staphysagria, CNS, irritation of nerve. Flower was used for healing in olden days. Seed is known to produce vomiting and toothache. Travels. What is staphysagria? Unfortunately, whatever we were trying to do was Sora, sulfur. Psychotic, thuja. Medorinum. Syphilitic, syphilinum. Acid nitric, Merxal. No, we can't have such things. Each medicine will have certain factors, certain sect of sora, and inflammation to progress it to psychotic states. The child who is hypersensitive to, I think I will only go through this only one case like this, then I will just run through. States of passive aggression, unable to express himself, sadness, anger, indifference. He often tries to maintain his image to pride, suffers from inside and out of touch to reality. We find the functional disturbances, indurations, hardness, syphilitic caries, and destruction. His consultation was 745, up to 6. It went up to 6 million. Staphysagria was continued. Wife delivered her baby in September 17. What I have not shown in this slide was I had given some doses of Beretta carb 1M here and there, tuberculinum 1M as an intercurrent remedy. Then you may ask, then where is the question of your simillimum? When the simillimum start functioning, or when the simillimum start showing a little bit of slowness in its action, then I have introduced these remedies and then continued with staphysagria, which has done wonders. Go back to the first slide of pathology. I'm sure it could have been certainly not entered. I could not have taken an entry point to this case if I were not to take another lateral route of life space investigation. Knowing the aphorism of 210, 230, that's why he has told very clearly, affects in turn affected by other energy fields, should study the mind and disposition of a patient, required similarity to disease force to be established. This is what the 210 to 230 operational aphorism. I think this, I will not go through this case because this was also the same way. I had given staphysagria because it was on the same way, prior experience. but Stephsagria worked up to a level and it did not. Like peeling one by one, I went through. I just could not get through after giving Stephsagria. Then I went to Boger's pathology. I took only 2 headings, retarded and slow. Based on that, I gave Barretta carbonate, and this came, it was 0 sperm count, it came to 83 million, and the couple delivered in August 2005. Now, what is the approach? How do you approach to a infertility case? I'm sure there is no right trial road method to select a simillimum. You have to choose your acute, chronic, constitutional, keynotes, specifics, specific nosodes, and initially, first itself you should decide whether the case is repertorial or non-repertorial. Who decides it? It is the case and the totality which decides. Of course, you all know that in homeopathy, probably in Ayurveda also, the physician does matter. What is his armory? What is his knowledge of wisdom? Which, of course, Hanuman or any others, they did not ask you to find out a system, but you should have a similar set of materia medica in your mind, which is embedded into you. The moment you see a case, you can straight away hit upon, which I am doing it now after 40 years of experience. The juniors, junior doctors, students, they don't need to wait for that 40 years of experience. If they understood the approach, I think they can do wonders. Knowledge of disease, knowledge of medicine, potency, repetition, miasm, susceptibility. If you would know this, whether it is infertility, whether it is diabetes, whether it is hypertension, whether it is autoimmune disorders, what not, whether including your what so called the COVID-19. If you know the aphorism 3 operational, you have done wonders. Oligospermia, this is my first analysis which I did, compiled 1,000 cases of infertility, out of which male infertility were oligospermia 110, oligoasthenospermia 50, asthenospermia 43. Please note, azoospermia 15, atrophic testis 5, undescended testis 5, medial reactive 1, erectile dysfunction 17, epididymal cyst 2, varicocele 6, no liquefaction of semen 1, obesity with neuroasthenospermia 1. Commonly used remedies in my private practice were, instead of using tuberculinum, I have always used tuberculinum testinum as a almost like an ozone. My regular remedies which were used were Barretta carb, in some cases tuberculinum alternatingly or intercurrent remedy, calcarea floor in duct obstruction, and thiocyanamine in duct obstruction, and as I told you, tuberculinum and tuberculinum testing. Erectile dysfunctions, you all know that Agnes castus, caladium, and selenium. Low sperm count, of course, again, though I have not written here, my almost all low sperm counts have done wonderfully well whenever it is matched with sulfur, calcarea carb, lycopodium. And in other cases, Barretta carb, tuberculinum, followed by 1 or 2 doses of syphilinum. Architis conium, wasting of testis, subal cerulita, of course, and lot of cases which give the history of mums in the used pulsatilla and parotidinum. These 2 remedies have really done wonders. I think I will have time left with another 10 minutes. Jose Isaac? Dr. Jose Isaac?
Yes, you can take another 5 minutes more. No problem.
How many more minutes can I take?
Take 5 minutes more.
Oh, then I have to run through. This was the case of a anovulatory cycle cases. And as I told you, it was this history of removal of left ovary, left tubes because of diagnosis of teratoma, PCOD. I just went physical generals, crave sweet, sweating 3, chilly, obesity. And mental state, pathophysiological correlation was anxious 3, insecurity 3, fears of being alone, desires company, dreams robbers. And straight away I went to Calicarbonum. I could have explained why Calicarbonum. The Calicarbonum, the centrality of the whole remedy is insecurity. That was my hit upon in this case. I will not go through the why what has happened. And there was a repeated abortions of a lady who had, I think, nine. She had previous pregnancies and she had 9 abortions. I was closing my clinic, last patient, the business class of the same road, they brought, I said, I can't see you today, please come tomorrow. They pleaded, then लाने दो, नहीं sir, वो सबके सामने नहीं ला सकता है. I cannot bring that patient in front of everybody. इसीलिए मैं last में आया हूँ. Okay, bring her. She was brought with only a very, very see-through saree. No inner wears of anything. Car mein, they had come in a car, immediately they almost fizzled into the clinic. I asked, what is this? Sir, the moment she conceives, she take away all her inner wears, bras, panties, घर में नंगा रहता है. She remains naked in her room. I did not think twice. I took only 3 minutes to prescribe. That was lachesis. Fortunately or unfortunately, next day, after 1 week, when I saw with her clothes, and when I went through her life space investigation, mother-in-law was almost dominant. You know, lachesis will not tolerate any dominance. And I could have explained the duality of the lachesis, intolerance of the power within. What did Alan say? What did Herring's guiding symptom? I know you must have all understood what is the Herring's guiding symptom. And Herring's Surukuku invention of this proving of lachesis. I will not go through the things since I am very short time. I think I will be going through susceptibility, of course, makes all the difference. And present a situation of all these modern software engineers who come to you with lot of problems, night duties, day duties, no understanding, each one is egocentric. A doctor has to keep a watch on what is going on thing. In thousands of another cases of females, unexplained infertility, which were very explained to me, was 232, PCOD 132, fibrosis 36, tubal blocks 37, anovulatory cycle 28, missed abortion 17, hypothyroidism 14, hypoplastic uterus 8, endometriosis 9, miscellaneous 51. These were some initially of my practice. Almost look at those here, 200 patients with mothers in front of the press. If you see the background of this mother, father, and the child, this is my clinic where I'm sitting now. I'm sitting in my room, but when I'm sitting in that room, they sit in front of me. I've taken just a snap because I don't have any modern things. With my phone, I have around 1,000 photos of this. Thank you so much for having given me this opportunity to share my clinical experiences. I could have had little more 15 minutes of time. I could have just brought out the way how I go through with the cases and getting results. I think thank you, Jose sir, Shaji Kodia, and for all the people who are watching this, thank you once again.
Thank you, Dr. Rudhresh. I hope you will be able to come to our forum again with more information and share your experiences in future. Now we have a question answer session. Those who want to ask questions can go to the chat box and raise your hand. We have only 8 minutes left.
Dr. Jose Isaac, how many are involved?
Around now 134 people are watching you.
Okay.
Somebody
Fine.
maybe want to ask you some questions. Those who want to ask questions can raise their hand in the chat box. Okay, I have a question for you, sir. On what indication you used to prescribe thiocyanamide?
Thiocyanamide is one such beautiful remedy which can resolve the fibrous tissue. Whether it is a duct obstruction or whether it is syndicate in the uterus, whether it is tubal blocks. I have seen bilateral tubal blocks being cleared with thiocyanamide and tubercle followed by tubercle pneumonium, in some cases medorinamonium.
Okay, usually which potency of thiocyanamide you are using? Because I heard your lecture once. Some
Actually,
years
earlier
back.
I thought,
Which potency?
You see, generally we all believe that any pathological prescriptions have to be somewhere in the medium potency of 200. I used to start with 200. When I see I don't get the expected result, I've changed the next potency of 1. Once I learned this through practice, I straight away started prescribing without second thought, 1 name only.
Yes.
Okay, Dr. Manoj GS, any questions?
Yes. Thank you, sir. It's a very nice presentation. I have compared the cases very well and kept a lot of photographs, very important as far as homeopathy is concerned. My question is, so what about your success rate in these cases?
Pardon? I am not very audible. You are not very audible.
What about the success
What about
rate?
the success rate? That's what he is asking.
Please repeat it, Isaac.
Yeah. No, the question
Can you
was.
please repeat?
The question was, what is the success rate?
Yeah. Success rate is around 40%, sir.
40%. Okay.
30 to 40.
One more question. In varicocele, what remedy you have found very useful?
Ferment, Bellis, Calcarea floor, Hemamillis.
Okay. Now, Dr. Logmani Gupta wanted to ask you some question.
Yeah.
Please unmute Dr. Logmani Gupta. Please unmute Dr. Logmani Gupta.
Yes, sir. Please ask.
Hello. Hello. Sir, am I audible, sir?
Yes.
Hello.
Hello. You are
Tell me,
audible.
sir.
Very nice and educative session. Really a
Thank you,
wonderful
sir.
presentation. We congratulate you for it. Sir, my question is very simple and very essential to know for me that in what age group you got maximum success in your results? Please, age group, up to what age we should take the patient with confidence?
Preferably below 30 would be more ideal to take the case. Because you also know after 30, and most of the cases who come to you, as I told you, there was one case of 9 abortions, sometimes 3 to 5 IUIs, 2 to 3 IVF cases, 30, 35, 38, there is a very chance of case going into the child into ADHD, autism, global developmental delay, and so on and so forth. You have to caution the patient that these are the chances. Are you ready? Then only you take up the case. Below 30 would be more ideal. In one case, I have done one lady of 47 years. That's the highest I have seen.
Okay, now I ask Dr. Anuradha Prasad to ask a question.
Okay. Hello, sir. Very good session, sir. I just want to know in the cases stenoteratospermia, what is the success rate in homeopathy?
Pardon?
What is the success rate in azoospermia?
Very, 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 very low. 2 to 3%.
Okay, okay.
Maximum 2 to 3%.
Now I ask Dr. Hariharan to come up with his question. Please unmute Dr. Hariharan.
Yes. Yes, sir.
Okay. Okay. Can you hear me, doctor?
Yeah. Okay.
Okay. Your class is very nice, but I want to know hemorrhagic cyst at ovary. Any particular medicine for that?
Yeah, Apis mellifica, Euphorbium,
Okay.
Vespa.
Okay.
These are the main remedies I use.
Okay. Any
And
miasmatic?
of course, not forgetting the miasmatic remedy to give one as an intercurrent remedy.
Okay. Which is the miasmatic intercurrent remedy?
See, if it is cyst, then I would always think of psychotic in nature. If it is infective, then of the tubercular in nature.
Okay.
And if there is a burst and going into so many things, of course, syphilinum I have very less used, but my remedies were tuberculinum and tuja.
Okay. Thank you. Thank you, sir. Thank you.
Thank you, Dr. Now we have a session, a Malayalam session at 9 o'clock. So I invite Dr. Shaji Kudia to give vote of thanks to you. Dr. Shaji.
Yeah, thank you very much, Dr. Rudhresh. You are the lion from South India, and we are very proud to have us in our forum today. Your presentation was so nice and so clear. We apologize for lacking in time, and hope that you will come back to our forum once again. And as from South India, we are proud of you. You have done a lot of things especially in Karnataka.
Why not? Why not? Why not in India?
Because being a South Indian, I wish to cluster you there.
We don't want to stop in India. We want to go international.
Yeah.
I did presented these 3,000 cases with Dr. Vitalka's classical homeopathy in
Greece.
Athens. That is in Greece. I did do that 2 years back.
Okay. Thank you. And you are one of the important gems of homeopathy we offer from India to the world. And from the bottom of the heart, we thank you on behalf of International Forum for Promoting Homeopathy. And I thank all those participated today's session. I hope you enjoyed the wonderful homeopathic experience happening in India, especially in infertility. And we have one more, we are already in time. So thank you once again, Dr. Rudhresh. We definitely
Thank
need
you.
you in our forum again. We will be approaching you for future events to happen. Thank you.
Thank you. Thank you so much. Thank you all. Thank you.
Come again.
Over to the moderators of Malayalam session. Please take over. In between, I wish to have one announcement that we are going to celebrate our 365 days. We are still seriously discussing the celebration duration and how to celebrate. We will soon come up with the best options in our hands. There will be a discussion session on this matter after our Malayalam session. Those who wish to participate, please join us after the Malayalam session. Again, we need financial support. We request your generous mind to support us. Please come forward to offer your support to the daily and celebration activities of International Forum for Promoting Homeopathy.